Dr. Reagan. Welcome back to CRxOWN Talks, where we clear up myths about Black health and break down the healthcare questions you wish you'd asked and the ish they should have told you. Today, we're digging into something that's really prevalent in Black communities: diabetes. And Black folks, if you know, are more than twice as likely to have diabetes and twice as likely to die from diabetes. And even though we all probably know someone with diabetes, we don't always have all the ins and outs. So today we have Dr. Nykkia Sellers, a nurse practitioner and diabetes expert who has her own practice in West Memphis, Arkansas. She's all about helping folks understand their numbers, manage diabetes, and take charge of their health. So let's jump right into the rundown. Hey, Dr. Sellers.
Thank you. Thank you so much for having me, Dr. Johnson. Let me first say I'm so proud of you and everything that you're doing with this podcast, and I just can't wait to see the impact in our community and beyond. So I think this is great.
Thank you. Thank you. Okay, question one. What's one myth about diabetes you want to bust right now?
Okay, so myths that I hear often is that I have diabetes, so I can't eat this, I can't eat white things, I can't have any sugar. So that's a myth. And the second myth, I'm just going to say really quickly, is she ate too much sugar, so she has diabetes. Those are the two biggest myths about diabetes that I would want to debunk or so.
Okay, we're about to get right into it then. First off, why are Black folks at higher risk?
So often, Black people are at higher risk of having type 2 diabetes, and that can come from family history, of course. Black people are also have higher risk of hypertension, cholesterol, which high blood pressure, high cholesterol. And so, again, family history, often the way we eat. And also, we have to think about healthcare disparities. Often, Black people don't have great access to care, may not have access to quality education. So, there's a lot of different factors why Black people are at a higher risk of developing type 2 diabetes.
So, since you mentioned it, what's the difference between type 1 and type 2?
So, type 1 diabetes is an autoimmune disease or disorder where the cells in the pancreas attacks itself. And so the body is no longer able to produce insulin, With type 2 diabetes, there's different factors that goes into that. It's more of the body, the cells that the pancreas has not producing enough insulin, or the insulin that the body produces doesn't work efficiently. And we do know it's more to that. There's other things, as your brain might not tell you that you're full, your muscle mass will not reuptake sugar, your kidneys may not pee off sugar. So there's other things to go into type 2 diabetes, but type 1 is autoimmune disease and type 2 comes from different factors.
Okay. Well, I know a lot of people have been being diagnosed with prediabetes and asking questions. So does that mean you have or will get diabetes if you have prediabetes?
So it does not mean that you have diabetes. It does put you at risk for type 2 diabetes. So with prediabetes, your sugars are elevated, but just not elevated enough to where we would say you have diabetes. So A1C, it gives us a summary of your blood sugars over the previous 3 months. And so if your blood sugar ranges from 5.7 to 6.4, we know you're at risk for you have prediabetes and you're at risk for type 2 diabetes. Now, there are some things that you can do. So it does not mean that you're going to get type 2 diabetes, but you do have a very increased risk. So if you're overweight or living with obesity, you want to make sure that you lose weight and keep that weight off. Also, you want to make some lifestyle changes, whether it's eating healthier, making better choices as far as like reading your food labels, see how many carbs are in different foods you intake. Also, you want to make sure that you're increasing your physical activity. The American Diabetes Association recommends 150 minutes a week, but you can break that up. So lifestyle changes, dietary changes, increase your physical activity can help to prevent or delay type 2 from occurring, as well as with weight loss.
That was my next question. What the top two things that lower risk? So weight loss and exercise?
Yes, so weight loss for sure. And also changing the way that you
Diet.
eat. And so a lot of times people don't know. People may not know that. I have people often, let me just say this. I have people, we'll talk about carbs, especially on their initial visit. We'll talk about different foods. And they'll say like, oatmeal is a carb? Yeah. But oatmeal is healthy. It may be. There are some healthy carbs, there's unhealthy carbs, and we need carbs. That's another myth. People think that you don't supposed to eat carbs. No, we need carbs to help give our brain, some power. So get our emotions going and all that. Because like if you go all day without eating, you feel sluggish, you can't think. So we need carbs. We need a well-balanced meal. And that's for people with or without diabetes.
What are some early signs that people ignore?
Well, I don't know if people ignore these things, but I will give some signs of diabetes or elevated blood sugar. You may have unexplained weight loss. You may experience that you notice so that you're drinking a lot more. You stay thirsty all the time. You may have frequent urination where you're just steadily using the restroom. You may just feel very tired and fatigued. Those are signs of diabetes or elevated blood sugar.
Okay. So you already mentioned that we don't have to cut out all sugar, so I know we're going to be happy about that. But what's a go-to snack that's diabetes friendly and Black approved?
Okay, that's a good question. My go-to snack that I tell patients about in the office, the Skinny Pop, and look, I don't endorse it or anything like that, but there's a Skinny Pop popcorn, and it has like a regular with the regular flavor, and then it has like a kettle corn, it has like a caramel type, and I think even a cheddar cheese, and so most of the carbs in the popcorn bags about 9 to 12 grams of carbs. And so for a healthy snack, I tell people to stay like less than 15 grams or so of carbs. And so they taste good. I have them in the office for patients. I also have them like at events that we go to. So that's something that's quick, healthy, and diabetes friendly snack.
Okay. Skinny Pop, send us an endorsement,
Please,
ad or something, okay? All
please
right.
do.
So
I
can
can use that
diabetes run in the
check.
family but still be preventable?
Yes, it
Okay.
can be.
Can
Now, yeah, it can be. It very well can be. We do know family history will increase that risk. So if you know that you're at risk, there's things that you can do that can possibly delay or prevent it. It's just, it does take discipline. It takes discipline as far as eating healthy, exercising, and that's hard. It's even hard when people have diabetes and they have to change the way that they eat. I always tell people like, you didn't get these lifestyle habits and everything. You didn't get diabetes overnight. You can't change those things over. So give
mhm.
yourself some grace, and do small things, work on small rewards. So you can prevent or delay even if you have family history, but you got to do some work.
Got to do some work. That's the hard part. I'm talking to myself right
Yep.
now.
Yep.
So let's get into some questions folks always wish they had asked. Why is my sex drive low? Is that from diabetes?
It definitely can be. So diabetes, that's a good question. I'm glad you asked that. Diabetes does affect like everything in the body. So, that's why I tell patients like when they come see me, I'm asking about everything and I want to make sure that we're controlling the overall health. So when I say the entire body, so we have nerves that are all over our bodies, of course. And so with men, in women too, you can have like numbness, tingling, and so and so. We also have nerves in those special areas, and so if you have decreased sensation, that can have you not wanting to have any kind of sexual interaction. Also, men with type 2 and also type 1 have low testosterone. So if you have low testosterone, you might have issues with erectile dysfunction. Also with women, especially when you get older, you already may have issues with like our hormonal levels, which cause vaginal dryness, decreased libido,
Mm-hmm.
and all that. So diabetes definitely can. And then also in women, if your blood sugars are uncontrolled, you may have issues like with urinary tract infection and yeast infections, and that can lead to vaginal dryness and just have you not wanting to do certain things. So
Yeah.
yeah, that's a good question. I'm so glad you asked that. Most people don't think about that, but
I
that's
know.
something
So
you
that's
need to
why
know.
this is the questions I wished I asked. What if I can't? Okay. What if I can't afford my meds?
Mm. Talk to your healthcare provider and just let them know. And hopefully, you have somebody that's understanding, that's compassionate. That's one thing when I do talk to healthcare providers, I tell them just don't write it off and say, hey, this patient is non-compliant or they don't adhere to the medication. Sometimes it might can't afford the medication.
Right.
So one thing that patients or people living with diabetes can do is be an advocate for themselves. They can say, look, I can afford this, I'm not going to buy this or whatever, care providers should be able to say, well, let's look at some alternative methods,
Right.
or if you have insurance, maybe we can use one of these savings cards. Also, there's things that different drug companies have, pharmaceutical companies have. They have patient assistance programs. And so, your healthcare provider, it may take an extra step for you and your healthcare provider to do, but it's worth it if you can get this medication for free or a lower cost to do an extra little paperwork so you can get it. And that's going to help you. And it also helps the healthcare provider because your blood pressure, blood sugar, whatever is going to improve.
Okay. So that's really good information about healthcare providers, because I think we don't talk enough about how we talk to our providers, right? Okay, one more is, everybody's on the Ozempic train, right?
Mhm.
And so a lot of people are asking, are the meds safe?
Of course, this class of medication has been around for several years. It started with another medication years ago that you had to take every day. And this has been over 10 years. And so, like, that medication was every day, then it evolved. As the field of diabetes is like ever changing, it's ever improving. I've been in the diabetes field for the past 11 years. When we first started out, we didn't have all the medications that protect your heart, protect your kidneys, all those different things help you with weight loss. But back to that point, it was a medication that you would take every day, then evolved to like a weekly injection. So it's steady improving. So these medications have been around for a while. And so they help with weight loss. Most of them help to decrease cardiac events. There's now studies that showing they're going to help with dementia, smoking cessation, also like with liver disease. Some have kidney protection. So there's a lot of things, good things that's come down the pipeline with these medications. So they're safe. Now, can everybody tolerate it? No. Can everybody tolerate Benadryl? Can everybody tolerate Tylenol? People have side effects of things. Some people do, some people don't. But that's all with talking to your healthcare provider, trusting them enough to say, hey, this doesn't really work that well, and hopefully they'll listen, and then they maybe can try it another class or so. But they're safe medications.
Thank you so much, guys. I think we made 10 minutes. I'm not sure, probably not. But anyway, thank you for joining me today. Before we go, give one final tip for Black patients who are looking to prevent diabetes before it starts, even if it runs in their family.
Be knowledgeable, ask questions, be an advocate for yourself, ask your healthcare provider to run, the test or whatever, and make the changes on your own beforehand with choosing to live healthier, eating healthier, and also increase your physical activity. But be an advocate for yourself for sure.
Thank you, thank you, thank you. And everybody, if you're in West Memphis or nearby, check out Dr. Sellers at Diabetes Care and Wellness for all of your diabetes needs or any other care needs that she may have. You can find her on our website. I'll put the link in the episode notes and also get you links to the American Diabetes Association, which might have some tools and tips for you too.
Yes.
Thank you for tuning in. Here's your crown check. Remember, you can change your health one choice, one meal, one walk at a time. This has been your health check-in with Crown Talks. If you love this, follow Cover Your Crown, share it, and subscribe to Crown Talks wherever you get your podcast. Medicine, our crowns are secured. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare provider before making any decisions about your health. The views expressed in this podcast are those of the host and guests and do not necessarily reflect the opinions or positions of any affiliated organizations.